My current pregnancy journey has been great. It's clearly in its post-part, which is awesome. It can't hurt to have information that you think will help your pregnancy be easier. It is definitely a good tool for planning in the future. Simon is our first. I really took advantage of the pandemic, being able to stay home and care for myself during my pregnancy. Not that I recommend it, but there were plenty of silver linings. Dr. Reed happened to be my OB/GYN. We felt in very good hands.
It's a very interesting day-to-day. I take care of pregnant patients, I deliver babies. In the genetics world, unlike a lot of geneticists, I see patients of all ages. So patients who are pregnant with a suspected genetic condition in themselves or their fetus. We see them and talk to them about the condition and what the prognosis could be. Family history is very important in regards to prevention of diseases. If you know that there's a family history of a genetic condition, then we can screen you for that condition many times prior to getting pregnant or in a pregnancy if you find it out sort of at that point. I saw Elise at the very beginning of her pregnancy. She has Ashkenazi Jewish ancestry. There are specific genetic conditions that we know are more common in Ashkenazi Jewish individuals. A pregnancy is considered high risk if you're considered what we call advanced maternal age, so over the age of 35 at delivery. If you yourself have had a history of pregnancy complications, if you have a history of genetic conditions that can make a pregnancy more complicated, or ultrasounds demonstrate abnormalities of the fetus or testing that's abnormal for the fetus.
Dr. Reed asked us what we wanted to do when it came to genetic testing, and she let us pick what my husband and I are most comfortable with when it came to getting screened.
Genetic counselors, we usually work together in the sense that they may be the primary person that sees the patient.
A genetic counselor has a unique education in both genetics as well as counseling, and they are able to use that background to help a patient or a family make a decision that is best for that patient or family. So there are many different types of genetic tests that a genetic counselor is able to order or interpret the results of. The main two categories that a prenatal genetic counselor is dealing with is screening tests as well as diagnostic tests.
We felt nervous and excited because we didn't know what we would find out. There was always more that we could know, but we wanted to make sure that we got just enough that we could handle, and we felt good with speaking with Dr. Reed afterwards.
These are typically tests that are screening for chromosome conditions during a pregnancy, such as Down syndrome, as well as something called carrier screening, which is genetic testing for a patient and or their partner.
There's not a specific age that someone should consult with a genetic counselor. It's mostly related to the clinical indication. Talk to your doctor prior to pregnancy about these types of genetic tests so that you're informed and have the most time to make the choices that you want to make.
Tufts was great. We found them very helpful and easy to talk to, and we're really happy that we did the process A to Z there.